Good morning, everyone, and welcome to the BTOG podcast. My name's Helen McDill, and I'm a Respiratory Registrar training in the Southwest Peninsula Deanery, and I'm also the Respiratory Trainee representative on the British Thoracic Oncology Group. So this is part of our regular podcast series entitled BTOG Does, where we have informal chats with experts in their fields and tackle the most important questions we all face in the diagnosis and treatment of thoracic cancers. It's important for me to say at this point that sponsors of BTOG do not have any role whatsoever in the planning, content, or delivery of anything discussed today. So today's podcast is entitled BTOG Does Training, which is something obviously really close to my heart, being a respiratory trainee and being the trainee representative on the BTOG steering committee. And it's a real pleasure today to introduce my fellow kind of trainee representative, Dr. Adam Januszewski. I'll just introduce Adam quickly before he can kind of say hello. So Adam's now a consultant medical oncologist at the Barts Thoracic Centre, and as I said, is my fellow trainee representative representing medical oncology. So he is a thoracic oncologist who completed his specialist training as a National Institute for Health Research Academic Clinical Fellow at Imperial College, and he's got a particular interest in trials and translational research, bringing treatments to patients with thoracic cancers. So good morning, Adam, and welcome to BTOG Does.
Thanks, Helen. It's lovely to be part of this, and it's a really positive thing, I think, talking about some of the our experiences of training with patients with lung cancer.
Yeah, absolutely. So I guess to start off with, Adam, what drew you to thoracic cancers during your kind of time in training as a medical oncologist?
So my first kind of exposure to patients with lung cancer was when I was doing my core medical training. I remember doing a rotation in lung cancer and upper GI, actually, and it was a really positive multidisciplinary team that engaged with the juniors, including myself. And it was, harking back to those days, it was the first time that the registrar said, do you want to do an audit with me? We're going to submit something to the BTOG conference. And I suppose that was my first exposure of the community of that is the thoracic oncology community. And then it just so happened that as I always wanted to do oncology, I went on my first rotation and placement was in lung cancer and thoracic oncology. And it was there on reflection that I think there were three things I think that drew me to it as a specialty. One is the patient. The patient is the medicine is really interesting. There's often comorbidities, and therefore each of their treatments are quite nuanced in terms of which is best for the patient, as well as patients that can be quite unwell. There's the team and the community. I think because our patients are complex, it requires a number of different team members, and there is a really strong community both within the hospitals and further afield. And then there's the medicines. And when I was my first placement, we only had some first generation EGFR inhibitors, and now the medicine and the research has expanded exponentially in a population that is particularly underserved. And so that's kind of what excited me about it and why I wanted to go into in more detail. How about you, Helen? Why did you decide to go down the route of oncology within respiratory?
So I think, as we were just talking about before we started the podcast, I did oncology as an F2 and really enjoyed it due to many of the aspects you talked about, particularly kind of the MDT team working. And then when I did respiratory as a core medical training, there were many aspects to kind of respiratory medicine that drew me, that ultimately I picked that as a specialty. I think that blend of acutely unwell patients with the outpatient management, with the procedural aspect, really appealed to me as kind of a respiratory trainee. But I'd always had that interest in looking after patients with malignancy. So I guess that kind of interest sparked then as a respiratory trainee. And I guess similar to kind of the aspects you outlined really as well, primarily kind of number one, I really enjoy working with the whole MDT. And I think lung cancer really is a specialty within kind of respiratory medicine that encompasses that, from our specialist nurses, working with yourselves as oncologists, for radiologists. I really enjoy that aspect of team working. I guess the second point, particularly as a respiratory trainee, is that the procedural side, we're often kind of involved very early, well, straight away really, in that diagnostic pathway. And I think that's kind of involved as I've been a respiratory trainee. So not only doing EBUS, pleural procedures, but also doing kind of more physician-led diagnostic procedures, such as pleural biopsies, neck biopsies, lung biopsies as well. That's something I've really enjoyed as well. And I think I guess the third reason is partly that diagnostic puzzle as well. When you see kind of patients and you're working things going out with the medicine and the diagnosis, and then that interface with the patients and their family, you often get in kind of thoracic malignancy clinics as well. I think something is really kind of powerful as well.
Which I agree. I think that the part and the pathway that respiratory physicians hold is really important for the patient journey. You know, they see you work them up with all the investigations. It's a really important aspect of the communication skills in terms of breaking the bad news before they come and see us as oncologists. And you can really tell. I mean, I feel very lucky that we have an excellent set of respiratory physicians that are engaged and proactive. And as you just said, working with respiratory physicians, I think, compared to many other specialties, I think respiratory physicians are very proactive and engaged with the oncology pathway. And that makes my life and our work much more easy, because by the time the patient comes to see me, they understand, they've had, you know, that journey explained to them.
Yeah, exactly. And I think that really just encompasses why I think it's so important. And I think, as you said, now kind of all the drugs and everything are so exciting. Our patients are living so much longer. So actually, I think that collaboration between us as respiratory and oncologists is kind of merging more, because our patients need to come back to see, I guess, me in respiratory for pleural effusion management, or they might come into the ward with pneumonitis from their immunotherapy. So for me, kind of having those relationships with the MDT and oncologist is not just at the beginning now, it's throughout the patient journey, kind of building those relationships. So I guess that's why I think it's just a really great subspecialty.
Yeah, I agree. It's like literally, I've got an issue, I pick the phone up to our respiratory physicians who are really proactive and engaged. And also, I enjoy giving the feedback, because I'm sure that you know what this patient has a EGFR mutation, the BRAF mutation, or they're doing really well on this. And you kind of, I imagine that as respiratory physicians, you kind of want to understand, you know, this patient, how they're doing. Oh, yes, actually, this patient's now 18 months down the line, their disease is kind of in remission, and they're doing really well. And I'm sure and there's that two-way conversation where I have, whereas the respiratory physicians may call me and say, "Oh, we've got this really sickly patient. Will you be able to see them quickly so that we can get them onto treatment?"
Yeah, no, exactly. And I think having established that patient journey, it's so nice, like you said, to hear that how well they're doing, because things have changed so much in lung cancer treatment now, haven't they? From kind of being with a patient, telling them that awful news and seeing how kind of devastated they and their family are, but then knowing the effects of treatment and hearing how well they're doing down the line is fantastic.
Yeah, absolutely. I suppose we've diverged slightly from the original topic of training and training around oncology, but I suppose that's kind of where our experience, because we've been doing it for a few years now. How did you, I suppose, develop some of the experience that you have in oncology in terms of from a respiratory perspective to get you to this position where you are now, an expert?
I'm not sure I'm an expert yet, but I think kind of clinically through training, I just took every opportunity I could to get involved in thoracic kind of malignancy. So going to as many 2-week wait clinics, MDTs, working with the specialist nurses. And then it was really, I guess, as you already mentioned, taking opportunities, particularly through BTOG. I think that was kind of my first thoracic malignancy conference I attended, and kind of the first place I published an abstract as well. So really trying to, I guess I'd got a bit of an initial interest, and then I had the opportunity to present an abstract and go to BTOG. And that really being when it was kind of face-to-face in Dublin, really kind of opened my eyes to the whole community that exists out there in thoracic malignancies, and really excited me to kind of keep on wanting to do that. So then I felt very inspired to kind of obviously want to go back to BTOG and kind of present further work that I'd done with, I guess, different respiratory colleagues throughout the Southwest, and respiratory trainees as well. So I think kind of BTOG played a really important part quite early in my career, founding that interest.
Yeah, it's similar for me. As I said before, you know, when you've got a couple of proactive registrars or consultants that are engaged with the community, and they draw you in to say, well, why don't you do this? Why don't you do this? Whether that's through the BTOG conferences or the educational days, you know, just getting that better understanding of it. Because as a junior registrar, kind of, you know, rabbit in the headlights, lots of things going on. You know, you're trying to get, you know, some of the basics right, and then actually developing that expertise and specialism it's a tricky one, because you don't want to put all your eggs in one basket as an oncologist, because often we specialize in two specialties, for example. But I think that over time it kind of develops, and so that, you know, whether there was a case that was particularly interesting that needed to be written up, or perhaps having a supervisor that's interested in a particular field and actually has some, for example, book chapters or something like that to write, is helping to develop that kind of experience and depth of knowledge, which not only is rewarding, actually kind of it snowballs, because then you become more interested about it, and then you kind of, and it goes like that, and then you become a consultant, and it continues in that fashion. So I think that's for me what kind of I've been doing. And I think what has been really useful, I think, for anyone, is actually having a good mentor or supervisor, so they can help guide you through that, telling you, you know, or helping you, whether it's a mini bit of research, whether it's a little bit of service evaluation in patients with lung cancer, or something like that, that actually starts focusing your mind on our patients with thoracic malignancies.
Yeah, absolutely. And I think you're right. It doesn't have to be anything big or groundbreaking. I think I always worried quite early on in my training that I wasn't having kind of amazing research projects, or I hadn't got amazing paper in the high impact journals. But it's really about, I think you said, having a mentor, just thinking even about service development ideas that then snowball and then can lead into bigger things, and that can be published and presented, and those lead on to bigger things as well. I certainly know that's how I've kind of sparked my interest and developed things along service development, kind of in the diagnostic lung cancer pathway at the beginning. For you, I however know you have done quite a lot of formal research and academia. How have you found that in your training, and I guess how has that played into kind of how you've developed as a thoracic oncologist?
Yeah, I mean, it was quite early on in terms of, as I said earlier, you know, we had some first generation EGFR inhibitors, and I found that fascinating. You know, we were starting to understand the molecular profiles of patients with lung cancer, and I think that we're very lucky that we probably lead the way across the oncology field in understanding the molecular profiles. So it's a really exciting field. So I did proactively looked for, I was an academic clinical fellow, so took some time out to want to try and understand some of that better, have a better depth of understanding in that. And so, yes, I went out and I then started a PhD in genomics of a rare type of lung cancer. And I think sometimes it's not the topic that's the useful bit. Actually, it's allowing yourself to have that time to be able to do that research and that reading and understanding on a a deeper level, not just, well, these are the protocols, these are the guidelines, this is what we do, but actually understanding why we do those things and how those technologies are used, and why you're finding a MET exon 14 mutations in some technologies, not in others. And it's that time that allows you to then get, to then do other things in terms of whether that's case reports and things like that. And I think it has undoubtedly set me in good stead for my role as a consultant, because I understand it better, and therefore I think it has a direct translation into the care that I can give my patients. And ultimately, the field is changing so quickly with new medicines, with new technologies, that that is one of the most exciting bits about as a medical oncologist, whether it's a new RET inhibitor or whether it's a new one of the other new molecular drivers, and which one's going to be next, and understanding how to access that information and how to use and translate into that patient that's in front of you. Because as I said before, I think our patients with lung cancer, there is so many nuances about them, because of their comorbidities, because of their pathology, because of their molecular drivers, because of their performance status, and all of those things together allows you to give a personalized approach to that patient. And that's why I pursued a higher degree in that. And I think it has definitely been a rewarding and important part, because our underserved patients have been, there's not been as much research as other tumor types, and therefore it is, I think, important to embed some of that research focus and mindset for every kind of interaction and that we have as a medical oncologist, thinking what's next for this patient in front of you. What about you? Because you also took some time out, didn't you, as a fellowship? How did you find that, and why did you do that?
Yeah, you're right. So I did a interventional fellowship, kind of between ST5 and ST6. And I think I wanted some time out, like you said, to kind of explore my thoracic malignancy kind of interest, to have a bit of time to do other projects, research things alongside it as well. I think primarily what drove me to do it is that I knew I wanted to ultimately subspecialize in lung cancer and kind of diagnostic skills, and I wanted to really enhance my procedural knowledge. So what it gave me is the opportunity, I guess, to kind of come off the training ladder a little bit from all those other commitments that we have to do, and kind of focus on that. So my job was really set up to kind of getting to 2 EBUS lists a week. So I got phenomenal EBUS experience running the kind of plural diagnostic pathway, so developing physician ultrasound skills and kind of in a one-stop shop, and doing lots of kind of lung cancer clinics, working with the MDT, and also service development as well. I was doing it as COVID hit, so really it was kind of, we had to think how are we going to make sure we don't forget about our lung cancer patients and still diagnose it. So I had the opportunity to kind of help with a lot of service development and remodeling around that time as well. And I think my fellowship gave me opportunities to do other things as well. So although I haven't kind of done a formal higher degree, it gave me great opportunities to have time to do, I guess, more kind of retrospective analysis or observational studies. We did a couple during my fellowship to allow me to go on and publish and present those, which has led to opportunities to publish book chapters as well. So I think it gave me a huge amount of opportunities. I think I always worried that I hadn't done formal research, but I feel my fellowship gave me exactly what I needed in terms of developing my skill set, but also those research critical appraisal skills as well, which I think are so important. So I'd really encourage any trainee in respiratory kind of interested in subspecializing and in going down that line of doing a fellowship as well.
Yeah, I agree. I think it's the skills you learn during that time rather than necessarily the topic.
Yeah, absolutely. So I guess to kind of bring things back to BTOG, that's kind of, we've obviously both developed an interest throughout our registrar training in thoracic malignancy, and our paths kind of crossed as BTOG training reps, me for respiratory and yourself for medical oncology. And we've been kind of working on things for 2 years now, or over 2 years. What do you think our aims were when we set out as trainee representatives, and what do you think we've hopefully achieved during this time?
Well, I think to start with, because it was new positions, and so we started off by just trying to understand what the community of trainees need from BTOG. BTOG were forward thinking in terms of thinking, well, actually, let's get more trainees involved. So, we obviously formed a survey, as well as speaking to other trainees about understanding, what extra support, what can we do for individuals. I mean, and the results of the survey, they wanted us to better educational opportunities, better networking opportunities. Those are the kinds of things that we heard. And I suppose that's where we kind of started as our baseline to do some of the initiatives that we've certainly started, not yet necessarily finished, but will continue.
And I guess, would it be helpful just to kind of talk a little bit about those initiatives if people aren't trainee members of BTOG yet, who are listening in, about what hopefully we can offer trainees through BTOG now?
Yeah, absolutely. So one of the first things that we set up was a BTOG Trainees journal club, which is about every 2 months. We have an expert as well as trainees all invited to a Zoom call where we have a discursive discussion, that's the wrong phrase, but where we all talk about a topical or interesting paper with an expert. And it gives a really good in-depth kind of two-way conversation or group conversation about some really practice changing things. And that's been successful, and it's been continuing to run. And I think it's a really proactive thing, because sometimes it's not done as well in journal clubs across the country. It's a bit sporadic. So having that central focus supported by BTOG is good.
Yeah, I was just going to echo, I've learned so much from the BTOG Journal Club in terms of my critical appraisal skills and appreciation for, I guess, translational oncology research. So I'd really encourage any trainee to join, not even if they're not a medical oncologist, or a respiratory trainee, a surgical trainee, just anyone interested.
Yeah, it's helped me understand some of that screening trials, just like you, I'm sure, understanding some of the interventional kind of drug trials as well.
Yeah, exactly.
And then I suppose the other things that we've done is we've set up a collaborative networking group on Slack, which I think is a good way of kind of bringing together interested trainees to talk about research topics, about contact, in terms of supervisors, or directing people in ways of other specialist interests. Which seems to be, which is only new, but it's also developing. I'm sure will continue to develop to hopefully bring people together, because I think that's one of the overall aims of BTOG, to bring interested individuals together.
And hopefully through our kind of trainee platform on Slack, we might be able to develop some collaborative working projects in the future, but perhaps between trainees in respiratory and medical oncology and pathology. I think it's a great opportunity for trainees to try and do that. And I know the other thing we're working on as well is hopefully on the website developing a trainee Pacific section with lots and lots of resources for trainees to be able to go to and easily find out about thoracic oncology guidelines, whether they're revising for exams or just wanting to follow up on what they've seen in clinic that day. So hopefully that will be a resource coming soon as well for trainees.
Yeah, absolutely. And it capitalizes on this so much educational material that BTOG has done already, and was also, organizing, whether they're study days, whether they're conferences, whether they're webinars, that actually bringing that all together in a kind of an easily accessible way for trainees is an important aspect of moving forward, because sometimes there's so much information out there, you just don't know where where to find it best. So hopefully categorizing and making that easily accessible means that it will be useful for everyone.
Absolutely. And I know both of us are coming towards the end of our terms as trainee representatives on the steering committee, sadly. So hopefully there'll be fresh people to kind of develop and continue the work that we've started here for trainees as well. Just before we finish off, I guess ultimately, how have you found being a trainee representative on BTOG?
Yeah, I've really enjoyed it. I think there's a willingness to listen to trainees' views on the executive, and adapting and changing ways to enable us to do the work that we've been doing to try and bring trainees and making sure that we've got the next generation of medical oncologists in thoracic, respiratory, and across all of the specialties. And having that input, I think, is really important as an organisation, because the trainees, as we know, the trainees are the future, and therefore adapting some of the things that BTOG has been doing for many years to have more trainee focus, I think is really useful. And I think that we've helped do that by having that. What do you think?
Completely agree. I was speaking to some colleagues, respiratory trainees, who were thinking about kind of applying for the position, and I said exactly the same. I think it's been a fantastic experience because the steering group have been so open to our ideas about how we can enhance trainee representation and what we can do more for trainees, because really acknowledging that they're the future of BTOG and also the management of thoracic malignancies. So I've really enjoyed it, and I've really enjoyed working on all of these projects with yourself as well. And hopefully it's kind of created really great resources for trainees to access in the future, and hopefully they'll keep on being developed as well.
Yeah, and this is just the start, to be honest. I mean, we've set the foundations. We understand where we are. We've done some few things, so I'm sure there's much more to be done.
Exactly, leaving it in a good place for new, fresh people to continue our good work. And just finally, to finish off, because 20 minutes absolutely flies by, you're now on the other side of training, and you're a consultant medical oncologist at Barts. How does it compare?
Oh, the big question. I have to say, all the hard work, it's definitely worth it. It seems like a long journey, but actually, on the other side, it is ultimately really rewarding. It is the patient that is at the center of all this. The thoracic oncology is so much about the multidisciplinary team and the collaborations that you develop. And it's that team that you work with to care for these underserved population of patients, and the medicines that are changing so quickly, and that every 6 months we've got a new drug. It's really exciting. So those three things, the patient, the team, and the new medicines, really make my job really enjoyable, and also rewarding. It keeps you on the ball because things are changing all the time and challenging, and that's exactly what I wanted when I became a consultant. And it always seemed like a long journey to get there, through different routes and a lot of hard work. And actually, once you get there, I've really enjoyed it. I hope to continue to enjoy it for many years. But yeah, I would say to people that are listening that thoracic oncology is unique in many ways to many others, and those are the three things. I think it's the patient. You get to know the patients very well, because that continuity of care, that we are leading the ways in molecular profiling our patients, and the teams are great, whether that's the local teams, the BTOG teams, and the community. We all want to push forward the care for our patients. that was a rather rambling answer, but
no, I think that was a perfect answer. It was a very heartfelt, honest answer, and I think shows what sparked your interest at the beginning as a medical oncology trainee and drove you to develop your interest in thoracic malignancy is why you enjoy your job so much now, which I think is really inspiring, hopefully, for anyone listening. So thank you so much, Adam, for talking to me today. I've really enjoyed our chat, and hopefully people listening can feel inspired about wanting to pursue interest in thoracic malignancy, in medical oncology, in respiratory medicine, and many other specialties out there that we've not spoken about today as well. So thank you. And thank you everyone for listening. I hope that's given you an insight into what training in respiratory and medical oncology and what we've been doing for BTOG is actually all about. For more information on BTOG, including educational events that we've talked about for trainees, our journal clubs, and most importantly, how to join if you're not a member, visit www.btog.org to join, and all the information's on there. Thank you very much.
Thank you.